Obviously, I'm not a doctor, so I'm not giving any medical advice. And that will start us off with the first question I'd like to address, and that's about finasteride. So the questions regarding around finasteride and the short-term side effects, the long-term side effects, things that are popping up on the internet which aren't too good. I've been on this medication, finasteride, for 19 years. I used to get it from Propecia reps when I worked for these doctors, and then they stopped distributing it. I couldn't afford it. I think I fell off for a year or two. That wasn't good. I have a lot of experience with finasteride personally. I have a lot of experience in the years I've been doing this with these doctors and using this as the #1 tool to prevent hair loss, primarily in men. Finasteride is an unbelievable tool, in my opinion, that can stop hair loss as the primary goal. What we want to do is stop the hair loss. If we can thicken the hair a little bit with it, that's fantastic. That's a bonus. If we can grow some hair back, that's a Super Bowl win. So what I see with patients using it is, I would have to say, exactly the same percentages that are documented in a 12-year case study that Merck did to get it approved by the FDA. As far as the side effects go, we just don't see them. We don't see the numbers that you would expect to see after going online and reading and Googling it and seeing the doctors are warning about it and people are warning about it, and horror stories about people that have had irreversible erectile dysfunction and inability to achieve an erection. These side effects that are documented online that you, the patient, is coming to the industry, and I'm part of that industry and talking about, we're not seeing. Ask yourself a question. The doctors that I consider elite in the industry, West Coast, East Coast, South, North, and outside the country, why would they constantly encourage their patients to get on this medication when the easy way would be to just say, you know what, if you're afraid of it, don't use it, let's do your hair surgery. What I like to tell patients is, if Dr. McGrath is example, which is my primary doctor that I work with around the country, I really love the way he handles patients because he's brutally honest and he's very, very ethical and he spends time with patients. If he told me, you know what, Steve, when you come down to Austin the next time, I want you to do a video and explain to patients that I'm no longer going to prescribe this medication. What I'm seeing out there, what I'm reading about online, is just too scary even for me. I'm no longer going to prescribe this. Done. Everybody that's on it, they're not getting their prescriptions renewed. You know what? His business would go up 40% a year for the next 6 years without doing anything. And he'd have a lot of unhappy patients, and it wouldn't be his fault. And they'd have to know that because they're going to start losing hair. Now, you're not going to lose the transplanted hair, but the existing hair has a lot to do with patient satisfaction in hair transplants. And that's the main reason why these doctors are so excited about it. So the industry, in this industry, there's approximately 265 full-time doctors that do this as a specialty. They're board certified. They're writing tens of millions of prescriptions over the past 19 years. And guess what? The side effects is the exact same numbers that Merck reported in 12 years of case study for FDA approval. And what is that? Well, depending upon your age, 18 to 65, you're looking at about 2.8% that you could have a side effect, primarily a little tick down in your sex drive or a little less ejaculative fluid. Now, to my knowledge and what I'm told, in this same industry, 265 full-time hair doctors, specialists, that meet every year for an annual event. The ISHRS is the governing body that holds the event. They spend half a day in a 5-day conference all around the world talking about nothing but Propecia side effects. And every single year, the same subject comes up. The doctors have pieces of paper. There's about 20 board members. They sit up at the podium, and the 200 or 300 doctors that are at the event, they open up the microphones and they say, okay, here's the list of this year's new side effects that the internet is reporting. Anybody seeing irreversible erectile dysfunction? Not one hand goes up. Anybody seeing inability to achieve an erection? Not one hand goes up. So the point is what the doctors in this industry that are using this as their primary tool to help you stop losing your hair, they're not seeing the side effects that are being talked about on these blogs and forums online. They're just not happening. They're not seeing it. I have made it a commitment to patients I speak to, mainly young guys who are scared of it. They're very good at Googling, obviously. They're very good at doing online research, and they're getting scared. And if I find one patient that says to me, man, I've seen your videos. I've seen you out there. You have a good presence. You seem like you're pretty honest. And I took that medicine and now my life is over. I can't have sex anymore. I'm done. That's the last time I'll ever talk about it. And I don't see that happening. So again, I'm not a doctor. You need to talk to your primary care physician. If you're really young, you need to bring your parents into this conversation. If you're really scared, it's going to create so much anxiety. Is it even worth it? But coming from someone that lost their hair, the month I walked out of my high school, when I was 18 years old, and I sat on the side of my bed, I was raised very religiously, and I prayed for something to help me stop losing my hair. 20 years later, they came out with a medication that is helping all these young guys of any age. You could be 48 and just start losing your hair. I consider you young. This is a tool that is irreplaceable. Nothing compares to it. Lasers don't compare. Injectable treatments don't compare. The Rogaine doesn't compare. Nothing compares to shutting down that DHT and not having any more hair loss. The last thing I'll say is going back to those approximately 265 hair doctors that are specialists at these conferences every year. One of the things that has never happened, no hand ever goes up, is if a patient has a side effect, and there are side effects, and they don't want to take the medication, their body doesn't like it, they come off the medication. There has never been one documented case in 19 years from any of these doctors where those side effects haven't reversed. Because basically your body turns on that DHT again. If you need your DHT, whether it's a mental thing, which is okay, or it's a physical thing, and you need your DHT, all you need to do is stop using the medication. The little faucet inside your body turns on the DHT, and you're back to the way you were before. Again, thanks for these questions. They're great. I'm always happy to help. Thanks for having me back to Austin. And don't forget to subscribe to Dr. McGrath's McGrath Medical YouTube channel.